Assalamu alaikum. People have heard of personality disorders, and this is something which is greatly debated and controversial within mental health. But we do have the diagnostic classification within the classification systems of ICD-10 and DSM-5. So, what is it? Well, essentially, it is a unhelpful and rigid pattern of thinking, functioning, and behaving. And the person who has personality disorder has issues relating to situations and people. This causes significant problems and limitations in relationships, social activities, work, and school. And we classify them into three different clusters. You may have heard of the term MAD, BAD, and SAD. So we have cluster A personality disorders. These are characterized by odd eccentric thinking or behavior, and they include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Symptoms include being paranoid, having a pervasive distrust and suspicion of others, having an unjustified belief that others are trying to harm them or deceive them, being angry or hostile towards perceived insults, having a tendency to hold grudges, um, having an unjustified and recurrent suspicion that their spouse or partner is unfaithful, being socially awkward, being aloof, being to be cold or indifferent to others, inability to take pleasure in most activities, limited range of emotional expression, being peculiar in terms of their dress, thinking, beliefs, speech, or behavior, having odd perceptual experiences, being socially anxious, magical thinking, which is believing that you can influence people and events with your thoughts. Um, Cluster B personality disorders, these are characterized by dramatic, overly emotional, or unpredictable thinking or behavior. And these include antisocial personality disorder, borderline personality disorder, also called emotionally unstable, which a lot of people have heard about, histrionic personality disorder, and narcissistic personality disorder. And these disorders are characterized by symptoms of persistent lying, stealing, repeated violation of the rights of others, being callous and remorseless, impulsive behavior, emotional dysregulation, unstable or fragile self-image, having ongoing feelings of emptiness, um, and stress-related paranoia, constantly seeking attention, easily influenced by other people, thinking relationships with others are closer than they really are, expectation of constant praise and admiration, arrogance, fantasies about power, success, and attractiveness, believing that you're more special than other people. And then you have the cluster C personality disorders. These are characterized by anxious, fearful thinking and behavior, and they include avoidant personality disorder, dependent personality disorder, and obsessive compulsive disorder. This can be manifested as being sensitive to criticism or rejection, avoidance of work activities, fear of disapproval, excessive dependence on others, being clingy, difficulty disagreeing with others, tolerance of poor or abusive treatment, urgent need to start a new relationship when a close one has ended, preoccupation with details, orderliness and rules, inability to discard broken or worthless objects, rigid and stubborn. So there's a lot of information there. So the main message is there is something called personality disorders. These are essentially personality vulnerabilities that cause people to have problems in their normal everyday functioning, whether that's work or whether that's their marriage or social relationships. One of the ones I wanted to detail a bit more is something called borderline personality disorder or emotionally unstable personality disorder. There's a lot about this in terms of media coverage and people using these terms to describe individuals who have difficulties in interpersonal relationships. Specifically, this disorder is characterized by a number of symptoms, which includes impulsive and risky behavior, such as unsafe sex, gambling, or binge eating, having an unstable or fragile self-image and low self-esteem, unstable and intense relationships, emotional dysregulation, so frequently mood swings up and down, often due to interpersonal stress, suicidal behavior and self-harming, intense fear of being alone and being abandoned, ongoing feelings of emptiness, frequent intense displays of anger, stress-related paranoia, poor distress tolerance. This is commonly seen in females who may have experienced trauma when they were younger. And this can impact marriages. So I have come across cases where, unfortunately, marriage is breaking down because one of the partners, whether that's the husband or the wife, has um, or meets the criteria for emotionally unstable or borderline personality disorder, but they don't understand why they are acting like this, and their partner does not understand why they're acting like this. So it's good and important to raise awareness that there is something called personality disorder, personality vulnerabilities, and it's not just something that individuals can control necessarily. It's something that manifests and causes significant issues. So an individual may constantly lose their jobs, not be able to hold down jobs, or not be able to kind of sustain a marriage because they've got a personality disorder. But it's not being picked up and it's not being treated. Treatment is notoriously difficult for people with personality disorder. The first thing is to diagnose it, and then there are usually psychological, psychoanalytical, psychodynamic approaches to deal with this. Maybe some counseling in terms of couples counseling and family therapy as well can be successful. Patients may require medication if they are also suffering from depression and anxiety um, and psychosis. So there's a comprehensive collaborative approach that needs to be taken. But the awareness is the first thing. So people should be aware that this is a big issue. And sometimes people can misdiagnose or misattribute it as bipolar affective disorder. But actually it's a personality issue. And we have a lot of treatment centers, long-term personality disorder units that deal with people with severe personality disorders um, that need intensive support. Until next time, Assalamu alaikum wa rahmatullahi wa barakatuh.